Hello class. As you all know, we were tasked with the assignment to have some sort of topic relating to well-being. So in this presentation, I'm going to be talking to you all about well-being of the atypical. More so, we're going to have a discussion on how early detection of ADHD and ASD is crucial to the overall well-being of children and hence the development of those children into adults. So up first, I just want to briefly gloss over what to expect from this presentation. First, we are going to talk about the foundation surrounding autism spectrum disorder as well as attention deficit hyperactivity disorder. Next, we are going to move into the symptom differentiations between female and male genders. Then we are going to look at the comorbidities of autism and ADHD. And I will also touch briefly on the small percentage of people that will fall into the category of having a diagnosis of both. After that, I'm going to touch on the processes in which a person, whether that be the individual, the parent, or caregiver, would take to get these diagnoses. And last but not least, I'm going to touch on treatments, coping strategies, well-being strategies, nonprofits, and also just a couple of controversial topics surrounding neurodivergence, nonprofits, and coping strategies. Per the American Psychology Association, attention deficit hyperactivity disorder most typically presents itself in challenges in everyday routines. For the intents of this presentation, we are going to focus mostly on younger children as well as adolescents. So ADHD is typically separated into two areas. Those are inattention and hyperactivity and impulsivity. So first, I'll go over just some common traits that are typically presented in most ADHD patients, and then I want to just briefly discuss some not so common traits. So again, since we're focusing on the age grouping of children, I am mostly going to be discussing the signs in which a person would need to be looking for in school-aged children. So first up, inability to focus on fine details. This extends to specific homework questions. So let's say that you have a student, they have a homework assignment in front of them. Instead of analyzing very fine details of a question or a prompt, children with ADHD are more likely to draw their own conclusions about what the question is asking, rather than read into the fine details. This often leads to children making the wrong choices on exams and their homework. Another common theme in children with ADHD are that they sometimes struggle to complete their homework, whether they forget or they just overall struggle, get upset, and then refuse to finish. This is often perceived as laziness. One of the biggest struggles in students with ADHD is that they have a more difficult time with keeping their personal effects, such as their pencils, their homework, books, etc. More uncommon traits are going to be defiance, interruption, blurting out answers for the teacher before you're called on, as well as aggression with other students. So next up, we are going to be looking at autism spectrum disorder. Per the American Psychology Association, autism spectrum disorder is defined as a complex neurodevelopmental disorder that affects behavior, communication, and social functioning. Most children and students with autism spectrum disorder have difficulty with effectively displaying their emotion, persistent, repetitive movement of their hands, rocking, twirling, flapping arms, Children with autism tend to want to stick to a very strict schedule. So when that schedule is disrupted, tantrums and outbursts are likely to occur. So there are a couple of not so common traits, but I only really want to focus on one of them, which is avoiding and resisting physical contact. So this is going to be a huge issue for children with autism that do not want to be touched in the school setting, whether that's playing, hugging. Children in general tend to be very touchy-feely, but when it comes to children with autism, that's not really something that they are comfortable with. So now to the meat and potatoes of how this connects to well-being. So as I already discussed from the beginning, this is going to focus on how well-being is impacted as the child progresses in age. Therefore, we are going to first look at the differences in presentation of symptoms between the genders. Females in particular are notorious for getting misdiagnosed or are not being diagnosed at all. Oftentimes, girls with ADHD present in the inattentive stage of ADHD instead of the hyperactivity. Therefore, the symptoms tend to be manifested in different ways, such as not paying attention in class, as well as having conversations with other students when they aren't supposed to be talking. But in a more serious sense, these kinds of mindsets towards girls and females with ADHD and autism, with the lack of representation, that can lead to chronic low self-esteem, higher chances of teen pregnancy, and often leads to early smoking developing in middle and high school. Per the Suicide Prevention Resource Center, individuals with autism spectrum disorder were nearly 4 times more likely to die by suicide compared to individuals without autism. Among those individuals with autism, males were over 3 times more likely to die by suicide. So in the overview, I mentioned that I was going to briefly discuss comorbidity of ADHD and autism spectrum disorder. So within that, I have these tables here. This is from a research study. This research study found that 54% of children between the ages of 6 and 17 years old diagnosed with autism spectrum disorder were also diagnosed with ADHD. The largest concern here is that typically, as the symptoms of ADHD and ASD are so different, most people, children in particular, get one diagnosis and the other one is missed. Up next, we are going to discuss diagnosis criteria. 42%. That is the increase in ADHD diagnoses over the past 8 years. Is this because there has been a rise in ADHD cases? No. This number has increased because of awareness of ADHD and what to look for. There are some very crucial and necessary steps in which a parent, caregiver, etc. should take in order to get the necessary diagnosis for their child. If you feel as if something is not right, there is absolutely nothing wrong with seeking out a professional opinion. As with anything medical-based, it's better to be safe than sorry. So take those concerns to a physician or a licensed psychologist. Typically from there, the physician or the psychologist is going to review family history. The provider may also end up wanting the caregiver to collaborate with the teacher of the child to have an overall culmination of behavior patterns of the child, and if necessary, speech and language assessments. For those with children that are not in school, the CDC recommends paying close attention to infant and toddler activity with the Milestone Tracker app. This tool is essential for any parent, however, especially important for those who suspect that their child may have ADHD or autism. This app breaks down milestones step by step of what to expect when your child reaches X amount of age. If your child is not reaching those milestones on time, it's absolutely encouraged that you take those concerns to the pediatrician. Now on to the most important part of the presentation, which is discussing coping and treatment strategies for those with autism and ADHD. The best course of action, per the guidance with Mayo Clinic, is to put emphasis on praise and rewards when rules are followed. Following rules, something that people with ADHD sometimes find challenging, so it's important to reward those behaviors. Next up is to establish healthy habits with your child, but be sure to make room for flexibility when necessary. Progress is not going to be linear here. Be sure to be very concise with requirements and directions when discussing things with the child. As for autism, the Mayo Clinic suggests at the top of the list applied behavioral analysis, as well as, or in conjunction with, family therapy. Sometimes physicians will also prescribe selective serotonin reuptake inhibitors, as well as other non-SSRI medications in conjunction with SSRIs. So continuing on with the discussion of coping and treatment and thriving with autism and ADHD, these are a couple of other things in which could be a successful tool to coping with either ADHD or autism. There's currently a lot of controversy surrounding fidget spinners and fidget cubes, and there's not a lot of empirical evidence that suggests that these toys improve concentration. However, as long as they're not overly distracting, science has suggested that they can at least be helpful for stimulation purposes. It's also highly encouraged to seek out support via the means of support groups in your area. I absolutely could not discuss autism without talking about Autism Speaks. Autism Speaks is a highly controversial nonprofit organization. As pictured here, the graph suggests 1% of Autism Speaks budget is diverted to family services. There's also a lot of controversy surrounding how Autism Speaks paints autism. So for those who are wishing to get involved with an organization, some alternatives to Autism Speaks are Autistic Women and Non-Binary Network, as well as Self-Advocates Becoming Empowered. I feel it's especially important to discuss support for people of color, as well as those that are in the LGBTQ community. These are notoriously underrepresented communities. The Autistic Women and Non-Binary Network assists with transgender and non-binary support, additional supports for neurodiverse queer youth, and also assists in access to legal aid, gender-affirming care, and mental health professionals. The Autistic People of Color Fund is a wonderful nonprofit organization in which people of color can apply for micro-scholarships to offset the cost of attending university or college. So in review, the well-being of children with autism and ADHD can be abundantly increased by knowing and having awareness of both common and not common traits, understand that it presents differently amongst genders, as well as knowing that there can be an overlap between ADHD and autism, using tools that are at your disposal as a parent or caregiver to seek out that early detection, establish a support system, and last but certainly not least, understand and recognize that each child's display of neurodiversity is tailored to their needs. Thank you for watching, and I hope that you enjoyed this presentation.